Welcome to Tuesday's edition of COVID-19. Our daily tally is standing just shy of 600 cases today amid rising concerns of variants and growing calls for homegrown vaccines. Speaking of the latter, government support to this end has been revealed, and we have more later on in the program. Here first is the broader pandemic coverage with our Kwon So-ah. Now, so as largely expected, there has been a rebound here in the local front.
Yes, Sunny, but maybe not expected to be by more than 90 cases, as we're seeing 595 infections as of 12 a.m. this Tuesday, and that includes 560 domestic infections and 35 cases from abroad. So if we go over to our graph, we are seeing here a rise by 94 cases from yesterday, but the bigger concern is if we compare the figure to last Tuesday, that's a surge by 201 cases. And with that, the total number of infections in the country stands at 156,167. And almost 8 out of 10 cases were reported in the capital region this Tuesday, with both Seoul and Gyeonggi-do province in the 200s, whereas we are seeing some decreases in many other parts of the country.
Right. Meanwhile, as you just mentioned, So-ah, the numbers in the Greater Seoul area look quite alarming. I understand authorities have come up, that is, with a plan to address this.
That's right, Sunny. The metropolitan region will be placed under a 2-week special prevention period beginning on July 1st, which means that coincides with a 2-week transition period for a new revised social distancing system. Now, in the 4th week of June, 74% of cases broke out in the metropolitan region, and in the 4th week of May, that percentage was at 64%. So that's one of the reasons for why the government has made this decision for the capital region, and more on that here from Health Minister Kwon Deok-cheol.
More than half of the cases have occurred through contact among small gatherings, while cluster infections at cram schools, bars, indoor gyms, and workplaces are also continuing to break out. Around 30% of cases have yet to be identified, and the Delta variant is also spreading in the capital region.
So given this situation, officials in Seoul, Gyeonggi-do province and Incheon are to make thorough inspections at high-risk facilities such as nightlife entertainment venues, singing rooms, places of worship, and cram schools. Also, if businesses are found to have violated guidelines, they will face a one-strike punishment, including fees and suspension of operations. Preemptive COVID-19 screenings will also be expanded. In Seoul, the mayor or the head of an autonomous district can implement an administrative order to get people tested for the virus at a place of a cluster outbreak. Test centers will operate for 2 to 3 extended hours from 9 a.m. to 9 p.m. on workdays and on weekends from 9 a.m. to 6 p.m. Now let's move on to our vaccination process. We've got over 112,700 people who've been fully vaccinated on Monday. And over to international issues, the highly contagious Delta variant has been found to be spreading in Africa, with experts warning, given that this continent has the lowest vaccination rate and also the weakest healthcare systems, that a similar crisis like that in India in spring could be unfolding there as well. Let's hope that will not be the case, and let's take a look at the numbers here. And also another country that is dealing with the Delta variant, the UK, so its highest figure since the end of January, with over 22,800 cases detected on Monday. And also here, Indonesia is seeing more than 20,000 new infections, while many European countries now are only seeing triple-digit figures, and that's happening in France, Italy, as well as Germany. And the number across the world of COVID-19 infections stands at almost 182.2 million. And those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for that for now. Right, recent findings show young adults account for a greater proportion of new infections here on the local front. And for more on this trend, I have our Chang Taeyeon with me in the studio. Welcome, Taeyeon.
Hi, Sunny.
Right, then let's begin with the pattern of recent infections that I just mentioned.
Okay, sure. So recent COVID-19 cases have mainly affected people in their 20s. Young people are seen to be especially vulnerable, as the majority of those under 30 have not been vaccinated as of yet. According to health authorities, on Monday, 636 people between the ages of 20 and 29 were confirmed with COVID-19 last week. That's the highest among all age brackets. Many young citizens in their 20s and 30s were infected at restaurants, bars, and other nightlife venues. But on a brighter note, Korea is reporting fewer infections among the country's older population. Take a listen.
60세 이상에서는 확진자
The number of cases among people over the age of 60 is continuing to fall, but we're seeing a rise in the number of patients in their 50s. You could say this is a visible effect of vaccinations.
Also, according to Lee Sang-won on Monday, Korea reported an average of 491.6 daily cases last week, a higher than 10% increase compared to 2 weeks ago. Cases are trending higher in all regions except Jeju Island, and the outbreak in the capital region is being fueled by cluster infections at private academies and bars.
Right, and adding on to concerns, Taeyeon, I believe, is the spread of the Delta variant here on the local front.
Sunny, Korea reported 73 new cases of the highly contagious Delta variant over the last week. Of these, 16 cases were traced to a restaurant outbreak in the city of Ujeongbu, northeast of Seoul, while others were linked to private gatherings and a group of vacationers, just to name a few. Authorities say more than 260 people were infected with one of the 4 major COVID-19 variants last week. That comes to a total of nearly 2,500 variant cases. In the meantime, Prime Minister Kim Boo-kyum said Tuesday that people who've received at least one vaccine dose can take off their masks outdoors starting from July, but this will not happen if the variant keeps on spreading.
Even countries with high vaccination rates are now back on high alert, given the dangers of complacency and the spread of variants. The new distancing rules will come with a greater emphasis on autonomy, but the virus can spread again if we don't act responsibly.
Korea has drawn up a list of countries with serious variant outbreaks, and travelers flying from these locations will not be eligible for quarantine exemptions that will come into effect on July 1st. There are currently 21 countries on the watch list, including India, South Africa, and Brazil.
I see. Meanwhile, Taeyeon, here's one final question before you go. I hear authorities are looking to expand the country's budget to boost domestic consumption.
That's right. On Tuesday, so that's today, the government and the ruling party have agreed on a new extra budget proposal worth around $29 billion. It includes funding for a new voucher program, which can be used to purchase agricultural and fishery products and can also be used at gyms, sports venues, cinemas, train stations, and bus stops. The voucher program will begin after more than half of the country's population have received at least one vaccine dose, which is likely to be in August. The government is also providing cashback incentives to people who spend more on their credit cards.
We will launch a consumer assistance program that will reimburse 10% of their additional spending on credit and debit cards.
Each person is eligible for up to 300,000 Korean won in cashback rewards, which translates to roughly $265. Spending at department stores, large retail stores, and luxury boutiques will not be included in the program in an effort to boost sales for small businesses.
All right, Taeyeon, as always, thank you very much for the coverage.
My pleasure.
Right, it's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Tuesday. Now, as mentioned earlier this week, come Thursday, that would be the 1st of July, COVID-19 restrictions will be eased nationwide, with the Greater Seoul area to face Level 2 social distancing guidelines and most other regions Level 1. For 2 weeks, though, starting on Thursday, authorities have chosen to tweak their guidelines for regions under Level 2, given current concerns over the region's daily infection numbers. A total of 6 people will be able to gather for social purposes as opposed to 8, which is the actual maximum number for regions under Level 2. But immediate family members face no restrictions under Level 2. Also, should daily infection numbers hold steady in the capital region, this area will be able to enjoy full implementation of Level 2 guidelines starting from July 15th. Meanwhile, restaurants, cafes, singing rooms and other nightlife entertainment venues will be able to stay open until midnight starting from July 1st. For regions under Level 1, most face a cap of 8 people for social gatherings until the 14th of July, and from the 15th, they face no restrictions. The briefing's about to start. We'll come back to you afterwards.
I am the head of the COVID-19 Vaccination Task Force, and let us now begin our regular briefing for June 29th. First of all, on the COVID-19 Vaccination Certificate, and starting from July, we will have a revamped social distancing schemes, and this means that we will have new guidelines for social distancing rules. And to this end, we also would like to introduce to you some details about the certificate of the COVID-19 vaccine. This means that anyone who have been vaccinated with the COVID-19 vaccine here in South Korea will receive a hard copy form of the COVID-19 vaccination certificate. And this certificate is the same form for other types of the vaccinations that are rolled out here in the country. And on this certificate, it has the name and the type of vaccine received, as well as the date. And this can also be printed online via the KDCA homepage, as well as the also the public health community health service centers, as well as the vaccination centers as well. And also starting from July, you will also have access to these certificates at local community, small-scale community public health centers. And these certificates can also be printed via in English. And also we have introduced the electronic form of the certificate via your smartphones. And this is the same format as the hard copy, and this is only a QR code system, and it provides a camera function. And right now the electronic format is only available in Korean. However, starting from July, we will also provide English version, while starting from September, we will also have 14 other languages. And together with Naver and Kakao, we will also have the similar QR code entry log for the vaccination as well. And also starting from mid-July, we will also have the COVID-19 vaccination certificate on your smartphone platform, so that you could check the entry log together with such certificate via your mobile phones. And for those who do not have access to these smartphones, starting from July, we will give out stickers that you could stick on your ID cards. And if you would like to get these stickers, please bring your ID and to the local health community centers, and it is a very small sticker that can be attached onto your ID card, and also it entails only the crucial information. And we ask you to also provide the ID card, your registration with the registration number, as well as driver license is also possible. And also we have experienced and reports of the people who are suffering from the rare cases of heart inflammation after getting the mRNA vaccines. And here in South Korea, we will also looking into these cases. A total of 1,200 similar cases have been reported in the U.S. And according to the latest report, most of these cases were young adults and teenagers who were male. And they also experienced symptoms after about 4 days after inoculation. And most of them also saw these symptoms after their second dose. And after a long period of taking good rest and treatment, most of them have recovered. And to this end, we also have discussed these details in detail, and also we have distributed these details to our medical professionals. And to this end, after you have been inoculated with the COVID-19 vaccine, if you are experiencing discomfort and also speeding of your heartbeat, and also difficulties in breathing or a severe chest pain, you need to visit a doctor as soon as possible. And if you are a medical professional who have been looking at these patients, you also need to report to us. And as for the vaccine supply, a total of 650,000 more doses will arrive in Incheon International Airport tomorrow. And this means that we will have the completion of the 7 million doses that have been scheduled to arrive within the first half of this year. And also starting from the 24th of May for the past 2 weeks, we also had the special campaign of walking together. And under this campaign, which have been participated by over 24,000 people, we also have received many comments online, and many of our individual public have also expressed their sincere hope to return to a state of normalcy. And we have selected 10 special comments as to receive special prizes. And lately, we are seeing our daily tally hovering around 500 to even 600, and we are also seeing an increase in the number of infections stemming from contacts with people. And to this end, we are also on high alert. It is very important that you wear your face mask, have regular ventilation, and also get tested if you have any symptoms. So once again, we highlight these basic quarantine rules. And according to the vaccination schedule, we ask you to also get vaccinated. And even after receiving the vaccine, you need to also wear your face mask at indoors. Thank you very much.
Right, that was Kim Gi-nam with Tuesday's afternoon briefing. So what did he have to say?
He's got some information on vaccination verification, because starting July 1st, we will have new social distancing measures according to the new 4-tier system. So beginning on that day, we will also have more incentives for vaccinated people, especially when it comes to the number of people who can gather for private gatherings. So there will be a verification for vaccination on paper as well as electronic verification. So everyone can get that paper document if they are vaccinated, but also the government is going to introduce a system that's similar to the QR code system that we're using, for instance, when we enter restaurants or other places. So the similar system will work for vaccinated people. They will just have to have an application, and then that will verify whether they have been vaccinated or not. And also stickers will be provided for people to get that verification, and that can be stuck on identification cards. Yes, so that's the gist of this new certificate system.
I see. All right, so thank you very much for that.
Thank you.
Right, like charity, equal access to vaccines needs to begin at home. Having said that, in this next report, we bring you details on COVID-19 inoculation for foreign nationals here in Korea. To take a look.
Morten Larsen is a journalist from Denmark who's been living in Korea for the past 3 years. With vaccines becoming available to wider segments of Korea's population, Morten wants to know whether he is eligible to get one as well.
I do know a lot of foreigners who experience a bit of issues getting the vaccine. There's partly the language barriers. A few of my friends don't speak Korean very well. And navigating the systems is a bit difficult when you don't speak Korean. I'm calling to inquire about getting the vaccine for COVID-19.
Getting the vaccine?
Yes, exactly.
Right. Do you have a national health insurance in Korea?
Yes, I do.
The Korean government has already announced that foreign nationals residing in Korea will also be eligible for vaccines, in the same order of priority as Korean citizens. Anyone with a long-term or permanent visa can sign up for a vaccine, which are provided free of charge. Booking a vaccine appointment can be done either online, by phone, or by visiting your nearest community center in person.
장기 체류를 하셨는데 외국인 등록 번호가 없거나 외국인 등록증이 없거나 건강보험에 가입을 안 하신 분들이 계신데 이분들의 경우에는 건강보험 가입이 안 되어 있기 때문에 저희가 일반적으로 맡고 있는 위탁의료기관에선 접종이 안 되고 보건소에 가셔서 임시번호를 부여받고 접종을 하시는 것은 가능합니다.
Foreign nationals are also eligible to register for surplus vaccines, but only if they're enrolled in Korea's National Health Insurance Program.
If there's any hospital nearby with leftover doses, but as everything is in Korean, it's a bit difficult to navigate if you don't speak the language.
However, information on how to sign up for vaccines is available in 10 different languages on the KDCA's official vaccine registration webpage.
저희가 이제 외국어 서비스를 아직은 준비를 못했어요. 그래서 향후에는 아마 이 영어라든가 이 주요한 외국어로는 외국어 서비스를 통해서 예약이 가능하도록 저희가 개선을 해나갈 예정입니다.
Currently, Korea is home to some 400,000 undocumented migrant workers, who account for 20% of all foreign nationals residing in the country. The Korean government is also offering vaccines to these migrant workers, regardless of their immigration status. There are concerns, however, that undocumented immigrants might be hesitant to step forward and get vaccinated, out of fear of being exposed and possibly deported.
감염병이 성별, 나이, 국적 여러 가지 체류 자격들을 따지지 않죠. 그래서 국내에 거주하는 모든 구성원들이 백신 조치를 받아야지 결국은 저희들이 원하는 집단 면역을 형성할 수 있습니다. 그래서 비록 불법이더라도 우선적으로 이주 노동자에 대한 인권과 건강권 차원에서 접종이 중요합니다. 그게 결국은 내국인의 건강을 지키는 길이라고 생각됩니다.
Making foreign residents equally eligible to the vaccines as Korean nationals will not only help resolve the issue of vaccine inequity, but also put Korea on the fast track towards herd immunity.
아스트라제네카사도 원활한 세계 백신 공급을 위해 한국의 생산 능력을 활용해 주기 바랍니다.
국산 코로나19 백신이 성공적으로 개발된다면 안정적인 백신 수급은 물론 국내 바이오 산업의 역량도 강화하는 기회가 될 것입니다.
특별히 mRNA 백신 개발을 위해서 정부 각 부처별로 범부처 협력을 기반으로 내년 예산 사업을 구성하여 추진할 예정입니다.
Researchers here are working around the clock to develop COVID-19 vaccines, and today we touch upon the advances made thus far amid the threat of variants. For more on this, I have Dr. Katharina Song from the International Vaccine Institute. Welcome back, Dr. Song.
Thank you for having me.
And I also have Professor Lee Hoon-sang from Yonsei University. Good to see you again, Professor Lee.
Thank you for having me today.
Right then, Professor Lee, let's start with the current COVID-19 supplies. Where does Korea stand?
So with the global shortage of the vaccine that continues, especially with the Delta variant, United States and many European countries are considering not only the first and second, but the third shot of the vaccine. So I think some of the shortage issues are still continuing. But one of the consolating fact is that soon there will be some Pfizer vaccines that will be available. So there will be some of the mix and match of the vaccines for many of the people who had received the AstraZeneca vaccine. So there might be some of the progress, but still, I think the shortage issue, I think, may continue to some extent.
Right. Now then, Dr. Song, what can you tell us about the latest efforts on the vaccine front to tackle variants?
So there are several COVID-19 variants that has different sequences from the original strain. Delta variant was first detected in India back in February 2021 this year, and Delta Plus was first reported by Public Health England in June 11th. But for the very new UK first cases was sequenced back in April this year. So Delta Plus seems to be more transmissible than the other strains like Alpha type, the regular Delta type. The part which distinguishes it from the other regular Delta type is that it has different spike protein. This part of the virus attaches to the cell that it infects. So vaccine developers are looking into version up vaccines to fight for these variants. Compared to pre-pandemic phases, we have a lot of different platforms of vaccines. mRNA vaccine is already there, viral vector vaccine is there. We have protein vaccines too. So for a new type of vaccines can be developed for all types of platforms, but the way to approach might be different by the manufacturers, and even within the same platform, the approach can be quite different.
I see. And staying with that, Professor Yi, what are your thoughts on the importance of developing a local COVID-19 vaccine?
I think it will be still very important because additional variant might still continues to develop. So in the future, having the capacity of developing vaccines, even though Korea is a little bit late in the process, but developing that capacity itself will be very important. Also, having the capacity to develop within Korea will be not only important for the current COVID-19 pandemic response, but it will be very valuable asset for any of the future pandemic as well. So I think it is still very important.
Right. Now, Dr. Song, you mentioned the mRNA technology. Now, there is talk about the necessity of mastering this technology. Could you tell us about how this vaccine development platform differs from its conventional counterparts, and what are the implications of this technology in fighting future pandemics?
So mRNA vaccine has a lot of advantages. It's very new technology that is adapted in this pandemic situation. So one of the general central advantage hinges on its rapidity of manufacture. Within weeks, clinical batches can be generated after the availability of the sequence encoding the immunogen. A facility dedicated to mRNA production can rapidly manufacture vaccines against multiple targets with minimal adaptation to processes and formulations. In addition, new targets requiring multiple antigens approaches will benefit from the speed in which mRNA can render multiple constructs. And another advantage of mRNA is that for conventional protein vaccines, sometimes you need to have eggs to grow the virus, and bulky tanks are required for the conventional maintenance of the virus in the manufacturing facility. Whereas mRNA vaccines doesn't require all of that because no virus seed is required to manufacture the vaccine. For the manufacturing of the actual vaccine, you actually require very small quantity of the liquid. That is about 100 milliliter of the liquid is sufficient to produce 1 million doses of the vaccine. So it's very new, advanced technology to produce vaccine. So as a production of mRNA vaccine utilizes synthetic production production method, it could offer a more flexible approach to tackling pathogens which are rapidly evolving, as well as the fast response in the face of a situation like pandemic we are in right now.
I see. And where does Korea stand with regard to mRNA technology?
So in overall picture, we have 5 developers who are developing COVID-19 vaccines in Korea. We have U Biologics, SK Bio, Solid, Genexin, Gene1 Life Science. So they are based on different kinds of vaccine platforms. For example, U Biologics and SK Bio, they are based on they are based on the protein vaccines, and Solid, they're based on the viral vectors. Gene1 and Genexin, they are utilizing DNA vaccine platform. But at the moment, we don't have mRNA vaccine in development in Korea. So outside of Korea, mRNA vaccine has been explored for quite a while. So back in 1990, there was studies going on for animal model, and after 2000, human clinical trials has begun. So it's been quite a while that the mRNA vaccine has been in development. The development of the vaccine was not easy, of course, and there were concerns about stability and large-scale manufacturing productions. It took a very long time and effort for the mRNA vaccine to be available nowadays, and it seems that Korea manufacturers may need to put a lot of effort to fill in this gap and to catch up with the mRNA vaccine development.
I see. Meanwhile, Professor Yi, what are your prospects and Korea's hopes to become a vaccine manufacturing hub for the region?
So while Korea is somewhat lagging behind in terms of the development of vaccine and developing especially vaccines such as mRNA vaccine, but in terms of the production capacity, Korea has quite a capacity of its own. Especially the 5 companies that had been mentioned, 5 pharmaceutical companies such as especially the Samsung Biologics, SK Bioscience, those companies actually has a capacity to produce quite large quantity of vaccines in very high quality. So Samsung Biologics and SK Bioscience had been partnering with AstraZeneca and Moderna and Novavax. So there is a lot of capacity that the Korea can function as a vaccine hub to produce vaccine in mass in very rapid process, also in very high quality as well. And I think the strength of the Korea's capacity is how Korea can generate and put together all this capacity in very rapid time, but still guaranteeing the quality as well. But also in terms of the variety of the vaccine that Korea can produce, even though it cannot develop in partnership with all these vaccine developers, Korea can manufacture a wide variety of different vaccines, including DNA vaccine or also including mRNA vaccines as well. So in that regard, I think Korea will be in very important place in terms of the global vaccine hub.
Dr. Song, the race to becoming a vaccine hub also includes China and Japan. Now, having said that, what do you believe makes Korea a potential winner?
So Korea has several advantages to become global hub for the vaccine. So Korea has a vibrant biotech sector and manufactures a good portion of world's monoclonal antibodies and biosimilars, and this experience will certainly help developing vaccines, which is another bioproduct. And Korea manufacturers have a record of being a being able to make vaccines with high quality, as Professor mentioned, and the government are very much committed nowadays to support for the vaccine industry to produce high quality vaccine. And also, Korea Ministry of Food and Drug Safety is recognized for the competent regulatory authority, recognized to be a competent regulatory authority who can guide and approve vaccines to meet the high quality that world requires.
Right. Moving on a little bit then, Professor Lee, 9 out of 10 Koreans want a homegrown vaccine, but very few are willing to partake in clinical trials. What are some ways, do you suppose, of boosting public participation in trials?
Well, probably providing some of the incentives mechanism for participating in this vaccine trial, because they are actually not only getting this vaccine for themselves, but they are contributing to the science. And if the vaccine development process gets accelerated, then the whole population will be benefited. So some of the various types of the incentivizing scheme, maybe even besides the monetary reward, can be nice as well. But also, I think the Korean government should communicate with the general public more proactively. In the UK and other countries, in the United States, there are various for public initiative, such as a human challenge trial, where many everyday citizens participate very actively for the development of vaccine, so that it is like a total war of these whole citizens coming together to really develop vaccine for not only for themselves, but for their community and for the whole populations. So I think there needs to be some kind of a campaign and initiative that the governments really promote how this participation into vaccine development really contribute for the common good of the whole population in the nation.
Right. And Professor, what are your thoughts on the waiving of patent protection for homegrown vaccines once they are developed?
Well, that is quite a difficult question to answer because actually this issue is not only for the homegrown vaccine, but I think this is issue about where Korean government take the positions in terms of approaching the issue of the intellectual property globally as well. But I think this problem is kind of a double-edged sword because if you waiver the intellectual property right too much, then it reduces the strong incentivizing mechanism for the companies to really invest a lot of resource and money and to develop vaccine in such a rapid speed. And innovation sometimes comes with all these financial reward incentives as well. So, but at the same time, what we have to think about is especially the developing countries. Right now, African continents are getting, they had been actually vaccinating less than 5%, around like 2 to 3% of the populations. And there will be actually, even though European countries and much of the Asia and Latin America gets vaccinated, if situation gets worse and if there is any additional variant that comes around, it will be not a good situation for the whole globe, so whole global population as well. So maybe while I would approach this intellectual property right issue very carefully, maybe to a certain extent, for limited scale, maybe some types of intellectual property waiver can be maybe taken place for a limited amount of the time for the very specific purpose. But overall, total waiving of the intellectual property, I would be a little bit careful in that approach.
Right. And Dr. Song, going back to the mRNA technology issue, what support framework is necessary for Korea to perhaps witness tangible advances in this field?
So to develop a vaccine, of course, it's very difficult. It doesn't happen overnight. So it takes a lot of effort a lot of fundings for a very long period of time. So even a big pharma company with a lot of experience sometimes fail to have successful clinical phase 3 results, which would be the last phase for the approval of the vaccine. So Korean manufacturers' experience in developing several vaccines like seasonal influenza vaccine, chickenpox vaccine, ZOS vaccine, DTP vaccine. So they do have experience, but for the new innovative vaccines, they still have a lot of things to overcome. So to develop a new vaccine that is based on the new antigens and new platform, even 10 years of time is not really enough. So, but for Korea, that we have a lot of great scientists in the bio ventures. So for them to endure this long period of time, and they can perform their science well, there should be enough support for them to survive this long period of vaccine development time and actually become able to produce the outcome for the vaccine. So in Korea, a lot of vaccines are already and another point that I would like to make is that in Korea, for performing clinical trials, there are a lot of hurdles because a lot of vaccines are already included in national immunization program. So for children and even adults, they don't really have to participate in the clinical trial to get the vaccination. So we need to solve this part of the clinical trial part for active participation to the clinical trial. I think that would be really important. And also in the other end, creative approaches to tackle all of this point needs to be discussed with the world of science, with the regulatory bodies, so that the current hurdles can be solved for future clinical trials and all other issues that happens in Korea.
Right, and staying with the same issue, Professor Lee, what backing do you propose to allow for advances in vaccine efforts here on the local front?
More investment from the government will be necessary, and the level of investment needs to be much higher than the current level. Last year, in the beginning of the COVID-19 pandemic, initially the amount of the Korean government spent in initial development and for the vaccine, for the research for vaccine and diagnostics in February of last year, the amount of the money that was proposed was actually spent was about in the size of the $1 million size, $1 million in the initial phase. And actually, Korea is buying F-35 fighter jet, which cost about $35 million per one plane, jet fighter plane. So what United States actually made emergency investment for the development vaccine was about $9 billion. And considering the size of the money that the government is spending, it is no surprise that United States is actually developing all those vaccines, and Korea does not have mRNA vaccine and vaccine development in very rapid speed. So I think a pandemic situation is like a war. I mean, the number of the people who died in the United States during the COVID-19 pandemic, it surpasses a number of the casualties and deaths that happened in all of the wars that United States has participated in the 20th century. I think the government really should treat responding to pandemic as up to the level of the national security threat issues as well. So the amount of the investment that government and the speed of the investment that government has to make should be much greater, and the government really should, I think, treat this as fighting of a major war. I mean, pandemic situation, as we have experienced, is almost like, as I said, a total war. The whole of government has to be responding, and it really makes a great cost to the life of the whole population. So I think the government needs to really make strong commitments, especially in terms of the size of the financial funding investment for the vaccine development.
Right. It has been a prolonged and continues to be a prolonged warfare against COVID-19. All right, Professor Lee, thank you very much for your thoughts. And Dr. Song, thank you very much for your insights today. Right, this week's planned ease in COVID-19 restrictions does not indicate an easing in virus transmissions. The move simply seeks to offer the public a greater sense of autonomy and responsibility amid the prolonged fight against COVID-19. Thank you for watching.